Welcome back to Today on Bay TV. I'm Gaynor Morgan and I'm joined now by pharmacist Reem El-Sharkawi and Dr. Lamah El-Sharkawi. Thank you very much for joining us and taking time out of your very busy lives, caring for us all. Antibiotics, it's very much in the news these days, isn't it? Perhaps they haven't been treated with the respect they deserve.
Yeah, no, I completely agree with you. So we're here to talk about what are antibiotics and also about antibiotic resistance as well.
So antibiotics basically they're medication used to treat or prevent bacterial infection. They can do this in two ways, either by killing the bacteria directly or by stopping them spreading. Like you mentioned, antibiotics don't work for all infections, so they don't work for viral infections. And some mild bacterial illnesses might actually improve without antibiotics, just with rest.
Such as?
So things like maybe conjunctivitis in kids, often bathing the eye with just boiling some water up and letting it cool right down can be just as effective as antibiotics.
We've become used to literally miracle cures, haven't we? Because was it in the 40s or 50s when antibiotics came out? I know they saved my mother's life. It was a sort of miracle, wasn't it? And we've become used to that now, and I think there's a problem in accepting if you can't have antibiotics or if whatever is wrong with you isn't suitable to be treated by antibiotics.
Very, very true. So obviously, as you mentioned, in the late 40s when antibiotics first came around, we used to probably prescribe it maybe a little bit too much because we didn't know as much about it. What I would say now, we try and reserve, as Lamah mentioned, we try and reserve the use of antibiotics for specific bacterial infections. So, you know, things like cellulitis, which is a bacterial skin infection, or things like pneumonia. Other bacterial infections, including contagious bacterial infections, for example, the sexually transmitted diseases like chlamydia, gonorrhea, we use antibiotics to treat those, as well as other contagious skin infections like impetigo, which is specifically, it's more prevalent, I suppose, in our younger population, in kids. We also use antibiotics as a preventative as well, which we call prophylactic use of antibiotics. So it prevents infection. This is only used in specific cases. However, it is...
Why would you do that?
So, for example, in patients who get recurrent infections, so, you know, things like urinary tract infections, we use it in patients who keep getting these infections. We'll use preventative antibiotics, and this can often be a great way of trying to prevent the infections from recurring.
It's not the same as, and there's been a lot of criticism, I'm a farmer, of farming because antibiotics in the past have been put in the food, haven't they? I don't know whether that's to ward off illness or for them to increase...
You're right. So that came in the news last week, I think. I think we've met, nationally, we've met the targets, or I should say our veterinary colleagues have met targets to reduce the amount of antibiotics or completely stop using antibiotics in the animals that we eat, basically to prevent them from getting into the food chain. And that would be the main issue, is once they're in the food chain, bacteria can become resistant to antibiotics, meaning that we get the creation of infections, as you mentioned earlier, that we can't treat at all.
And of course, antibiotic resistance is a very, very big issue. I think perhaps we can see for ourselves just what it involves. Yeah.
Antibiotics, we're wonderful pills, but don't ever think we'll cure all of your ills. So every time you feel a bit under the weather, don't always think that we can make you better. Take us for the wrong thing, that's dangerous to do. When you really need us, we can stop working for you. So please don't end up paying the price. Always take your doctor's advice.
It's difficult, isn't it? And I think Dame Sally Davis, she's the Chief Medical Officer for England, I mean, she warned recently that even things, I mean, I had a new hip, you know, things like that, you just wouldn't be able to do them. You may not be able to do them in future if our antibiotics don't work.
Yeah, absolutely. I mean, I think it was mentioned that it could be a catastrophic, and I think that's a very good description of what we're dealing with here. You mentioned things like hip replacements, other operations, for example, organ transplants, or someone receiving chemotherapy. You are often reliant on antibiotics, and if they're not as effective, this can have severe effects, for example, prolonged illness or sometimes even death. I think Public Health Wales reported that across Europe there were 25,000 deaths which were attributed to antibiotic resistance. And that's a huge amount. And apart from things like prolonged illness and obviously, as we mentioned, death, there's things like that people are staying longer in hospitals because we're unable to treat these infections. And that obviously has a huge implication on the financial side of things for the NHS as well. So it really is a big problem.
Very traumatic for individuals. Reem, what's speeding up the spread or the increase of antibiotic resistance?
So the main issues we have are the misuse and overuse of antibiotics. First of all, starting with the misuse of antibiotics, as Lamah mentioned, things like using antibiotics for a common viral infection is not appropriate. You don't need antibiotics for this indication.
People are quite insistent that they do, aren't they?
They are, and I think that's I suppose a struggle that we face on a day-to-day basis as well. So I think the doctors will assess, or pharmacists working in GP practices assess the need and assess symptoms that patients are presenting with, and if they feel that maybe this is going to resolve with symptom management, like paracetamol, just to keep the temperature down and things like that, then this would be a more appropriate way of managing, you know, the common viral infection.
So how are healthcare professionals combating this problem? Because isn't it a sort of bigger scale than just us?
Yeah, it's a huge scale. So we're working as a multidisciplinary team. So pharmacists are working with doctors, whether that be in GP surgeries like myself, where we work with our GP colleagues, or in the hospital where they work closely as a multidisciplinary team, looking and reflecting on our prescribing of antibiotics. But also we are given great guidance by, for example, our local health board on what antibiotics to use with particular indications, and we're given even more guidance at a national level. So there's a Welsh campaign going on at the moment, as well as a European campaign as well. And then furthermore, our society, so like the Royal Pharmaceutical Society, provides great information for pharmacists, and likewise the GPs are provided with great toolkits from the Royal College of GPs, helping them in prescribing antibiotics.
And what's the role of patients? Not to pester so much? Easy when you're ill.
Well, no, of course it's not. We've all been there, and it's horrible when you're feeling unwell. I mean,
your child.
Yeah, absolutely. And I always say to my patients that if they are concerned, that it's always best to seek some medical advice. So, you know, some illnesses, like we mentioned, will resolve by itself. But if you are concerned or you feel that you might need antibiotics, then go and see your GP, who, like Reem said, will make an assessment by asking you lots of questions about your symptoms, perform an examination, and then decide whether it's appropriate to prescribe antibiotics. If it is appropriate to prescribe antibiotics, then it is important that you take their advice and take the antibiotic course, finish the course.
Whole course.
Absolutely, as our friendly pharmacists, I'm sure, will advise you to do. Yeah, and just, you know, make sure that you're taking it properly.
Is that things go in swings, and doctors are more reluctant to prescribe now, and sometimes a dose is too weak, and that can be counterproductive as well, can't it?
Yeah, absolutely. But like Reem said, you know, we are following guidelines locally by ABMU, which is our local health board, who provides us with what's the best dose to use for patients, and will take into account if they have problems with their kidneys, then you might need a reduced dose, or if you're a child, obviously you might need a lesser dose. But we are following guidelines, but obviously we have to, you know, only give antibiotics when we feel it's clinically indicated.
I think the main worry we have now now is that there are infections today that are no longer responding to antibiotics, and I think that's of great concern to us.
Very, very worrying.
So this isn't happening in the future. This is
Listen
happening
to your
now.
doctor, help your doctor and your pharmacist. Really. Thank you so much.
Thanks for having us.
Enlightening as ever. Thank you for joining us, and thanks to all of our guests today for joining us. And of course, where would we be without you guys at home and online? So join us again tomorrow.